Okay, so now we are going to look at types of shock and some related important points regarding shock. So first of all, we are going to look at hypovolemic shock. In hypovolemic shock, cause is hemorrhage or any dehydration or burns. Cold, calming skin will be there and preload will be decreased because blood availability is less in the vessels. Cardiac output is decreased, heart rate will increase and compensatory mechanism and vascular resistance is also increased. Oxygen delivery is decreased in hypovolemic shock. Next one is cardiogenic shock occurs in AMI, heart failure, valvular heart disease, arrhythmia. Cold, calming skin will be there and decreased preload and after load will be there. Obstructive shock, there is cardiac tamponade, obstruction, pulmonary embolism, tension, pneumothorax, and calming cold skin will be there in the obstructive shock. Next one is septic shock. When there is bacterial infection, sepsis, or an infectious cause, body will be warm and there will be decrease in the preload will be there. So in this way, we classify shock system. Another one is clotting factors. Clotting factors are different like fibrinogen, prothrombin, tissue factor, calcium, labile factor, and other clotting factors, Hegman factor. Okay, so thrombosis occurs when there is circulatory stasis or endothelial injury or there is hypercoagulable state. Any problem in this can cause thrombosis. Varicose triad, hypercoagulability, hemodynamic change, and endothelial dysfunction or injury can cause thrombosis. Thrombogenesis is a process it results into the interaction of the platelet with endothelium. Damaged endothelium can result in the coagulation cascade development, and platelet adhesion results in the platelet aggregation with the endothelium, and then there is cascade formation through intrinsic and extrinsic pathway. So in this way, coagulation happens through these two pathways like intrinsic and extrinsic pathway. Intrinsic pathway is initiated by tissue factors. Extrinsic pathway involves activation of the clotting factors. Intrinsic pathway there is complex intrinsic coagulation activation like factor 9 and 10A, and then in extrinsic pathway involvement of the factor 12 is there, and factor 12 comes in contact with collagen. It activates the factor 12A, and then 11A, and then 9 and to 10A. So in this way, intrinsic pathway is activated by these different types of the activation. As we can see, intrinsic pathway, there are intrinsic pathway activation by the endothelial collagen, and then heparin acts on intrinsic pathway like PTT is used for intrinsic pathway. Factor 8, 9, 10, 11, and 12 are used for intrinsic pathway. Mnemonic is like 8 to 12, 8, 9, 10, 11, and 12 are used for intrinsic pathway. Now there are different types of the thrombi like arterial thrombus, venous thrombus, mural thrombus. Different types of thrombi are there, arterial and venous thrombi. So how can we classify these? And there are other types of ebola as well like pulmonary ebola, arterial fate, air embolus, and amniotic fluid embolus. As we can see, pulmonary embolism occurs because of air in the vein or any other cause. Arterial ebola occurs because of embolism, embolic arterial disease, and chamber disease. Fat embolism occurs when long bone is fractured, and then amniotic embolism occurs when amniotic embolism